Good afternoon. Thank you for the opportunity to speak with you today about the use of virtual reality simulation for mechanics of ophthalmic surgery training. I am an ophthalmologist and simulation educator based in Miami, Florida, in the United States. I am a consultant to Help Me See. This training is a partnership between the Bascom Palmer Eye Institute, the Gordon Center for Research and Medical Education, and Help Me See. The simulator is located on the University of Miami Medical Center campus. Dr. Alfonso, the chairman of Bascom Palmer, is supporting this collaboration. The simulator is currently being used for the training of surgical skills and the fundamentals of eye surgery to Bascom Palmer residents and fellows and pre-ophthalmology medical students on their ophthalmology rotation. I am a voluntary assistant professor of ophthalmology at Bascom Palmer. The Gordon Center for Research and Medical Education is part of the University of Miami Miller School of Medicine. It is one of the premier sites in the world for research and training in the use of simulation for medical and surgical education. Help Me See is an international humanitarian nonprofit organization based in New York City. Help Me See's mission is to eliminate global cataract blindness through the use of simulation-based training. The simulator is being developed to train surgeons in manual small incision cataract surgery in India and elsewhere. Help Me See was founded in 2010 by Al Yolchi and his son, Jim. Al was the co-founder of Orbis International, famous for the Flying Eye Hospital. Prior to Orbis, Al started Flight Safety International, the leading training organization for airplane pilots. Building on Flight Safety International's experience in using simulators to train pilots, Help Me See is incorporating the best practices in the use of simulation in eye surgery training. I spent years of my career as an ophthalmologist training eye surgeons in surgical skills. 18 years ago, I worked for 1 year on the Orbis Flying Eye Hospital. During my year, I participated in the 3-week plane program when the plane was based in Ahmedabad, here in India. More recently, I was the chief instructor for Help Me See, and I was based at the Help Me See's Learning Development Center in Mumbai. The Help Me See simulator is the centerpiece of the Mechanics of Ophthalmic Surgery program. Learners are taught how to use surgical instruments skillfully to engage with eye tissues efficiently and develop surgical judgment. In the United States, residents are taught clear cornea incisions for phacoemulsification and are not instructed in the creation of scleral tunnels. As a result, many ophthalmologists do not have proficiency in ocular incision and dissection skills. Surgeons competent and confident in ocular incisions and dissections can use these skills for manual small incision cataract surgery, conversion from phaco to scleral tunnel in complicated cases, secondary intraocular lens placement, and trabeculectomy. The Ocular Incisions and Dissections course is valuable for training and assessment. The target audience is ophthalmologists who want to learn new skills, as well as expert surgeons who want to assess and improve their technique using the simulator. The goal of training on the simulator is to improve the skills of surgeons so that when these surgeons begin operating on patients, they're at a more advanced level. In terms of assessment, just like athletes who can analyze their swing to understand how to hit the ball maximally, ophthalmologists can now analyze their surgical technique. Why is an incision or dissection not uniform, or shallower, or deeper than the ideal? Help Me See has created a simulator for training anterior segment eye surgery, which is high fidelity, extremely similar to real life. The simulator is built atop physics models based on measurements obtained from live eye surgery and is tuned by ophthalmologists who are experts in both eye surgery and simulation. Graphics are then overlaid on the physics models. Simulation has advantages over plastic models and animal eyes. Eye models can only be used a limited number of times. Animal eyes differ in size, shape, and anatomy from human eyes. The simulator provides real-time feedback. Intraocular pressure, the angle of the instruments in relation to ocular tissues, and dissection depth are graphically represented within the microscope view. This allows learners to make adjustments and modify their technique. After each attempt, a performance report is generated. Length and depth of incisions are recorded. Videos of each attempt can be reviewed to improve performance. In this screenshot, a performance report has been generated. The length of the scleral groove is measured and reported for analysis. Buttonholes, premature entry, uveal prolapse, and scleral lacerations are all captured. All Help Me See simulation-based training is instructor-led. The instructor is an ophthalmologist who is continuously watching the learner, analyzing the objective feedback, and giving instruction in how to modify and improve the surgical skills being taught or analyzed. Working in a safe simulation environment has many benefits, notably the ability to make unlimited attempts and to learn and practice surgical steps out of order, learning easier steps first while saving more difficult steps for later. The Help Me See simulator provides realistic graphics and tactile feel, reproducing the live surgical experience through the surgical microscope. Because the simulator is high fidelity and close to real life, the visual and tactile cues simulated are the same as those a surgeon would use in live surgery. And now, for the fun part, a comparison of real live surgery and the Help Me See simulator. The simulator currently has 5 assignments: controlling partial thickness scleral incisions, controlling ocular dissections, controlling corneal incisions, controlling viscoelastic and aqueous exchange, and the complete scleral tunnel. Although in the upcoming example, the steps are presented in real order as a comparison with live surgery, during the course, the steps are taught out of order. For example, controlling a stab incision is taught before controlling partial thickness incisions, easier tasks before harder tasks. When controlling ocular partial thickness incisions, trainees learn how to change the depth of the cut by modifying the force of the blade and the stiffness of the eye, how to cut curves on a convex surface, how to maintain the cutting angle, how to change the direction of cutting, and how to handle various orbital depths. When controlling ocular dissections, trainees learn how to create a central tunnel by pivoting the crescent blade tip, how to control depth by positioning the blade, how to slice instead of chop, and how to change the position of the globe with forceps while cutting. When controlling corneal stab incisions, trainees learn how to align the blade for entry after first contacting the eye wall, how to extend the length of the stab entry, how to avoid damage to intraocular tissues, and how to compensate for deep orbits. Here you'll see how the paracentesis is being made. When controlling viscoaqueous exchange, trainees learn how to hold and inject with a syringe, how to enter and orient with the cannula, how to inject and maintain IOP, and how to determine how much viscoelastic to inject. When using the keratome to enter the anterior chamber, trainees learn how to stabilize the keratome tip, how to make a three-plane entry, how to follow the corneal curve, how to avoid damaging eye structures, and how to handle deep orbits. In this example, principles of maintaining good exposure and visibility are taught. Arcus, the handle of the blade, and blood can all make visibility difficult. Learning how to adjust and compensate are emphasized. The learner directs the instructor to wash the incision clear of blood. The course is taught at Bascom Palmer with 1 or 2 learners at a time in a 6 to 8 hour session. In Mumbai, studies are being conducted using the tunnel construction course. The future of ophthalmic surgical training and assessment has arrived. Please experience it yourself. The Help Me See group has a booth here as well as conducting a workshop. It has been a pleasure talking to you today, and thank you for your attention.